Welcome back to another video. In today's video, I'm going to talk about violence in nursing. If you're looking to gain more knowledge about the nursing profession or to improve your nursing skills in general, please consider subscribing down below. I'll upload a video every Wednesday and Sunday that will help you gain better nursing skills and improve your overall practice. The reason why I think violence in nursing is so important for us to raise awareness about is because it's so prevalent. There's so many different reasons why a patient can be violent. One of them is obviously because of their condition. Someone's septic or is actively withdrawing from alcohol, or someone is in an active psychosis because they went off their medications. All of these reasons can make the patient more elevated and ultimately make them more violent to the nurses. And the professional who is treating the patient every single day is the nurse. So who's at risk for having the patient be violent against? The nurses. And so for us, we need to be aware of this. And a lot of times we're so focused on providing the most efficient, the most effective, and the most meaningful care, we forget about our own safety, which should always be our priority. And we often get struck by the patient, or we get injured in some way, shape, or form. There have been many times where, as a nurse, I've witnessed my colleagues almost get struck by a patient just because they weren't expecting it and the patient had no indicators that they were violent in the past. So as you know, the patients have a history, and within that history, we can identify if they've been violent in the past. But what if they've never been violent, like I just mentioned, and they all of a sudden become aggressive, and you turn around and all of a sudden that's when they want to strike at you? Well, that's where you get injured the most, and that's why nurses need to be on their toes, especially if they see patients that are septic, or if they see patients that have the potential of going into active delirium. We need to be mindful of that and be able to carefully position ourselves in a safe situation. Another thing that's worth mentioning is the fact that new nurses tend to put themselves at difficult and risky situations with patients just to prove themselves that they don't need help or to be more time efficient. And this is very dangerous because you ultimately risk getting yourself severely injured by a patient who could be in delirium. So I think it's very important, especially if you're a new nurse watching this, you need to be very careful and don't be ashamed of asking for help. Always asking your colleagues to assist you for a patient that you might think might have an inch of violence or aggression in them. You always should ask for help and make sure that you're able to provide effective care, but also very safe. I thought this video would be very interesting, and I thought I would raise awareness about violence in nursing because we do see a lot of news articles that talk about a patient who acted out on a nurse, and a lot of the media does take note of it, but there is a disconnect about why this happens, and a lot of times it's because the patient themselves are in a certain state of mind where they can't control their actions, or they can control it, but their cognition is not there to really understand what they're doing. If you thought this video was interesting, please give it a thumbs up. Please subscribe down below. I'll be uploading a video every single week. And let me know what you think down below. Have you ever noticed any acts of aggression by patients? And if you could share this video with one friend, I would really appreciate it as well. Thank you so much, and we'll see you in the next video.